Hey everyone, I'm Derek DiCamello. I'm a family nurse practitioner and co-founder of the Medical Aesthetics Association, TMAA. In addition, Esther and I own and operate a medical spa with a weight loss focus. So this is what we do every single day.
And I'm Esther DiCamello. We created this course because obesity medicine is personal for us.
I was 400 pounds. I had hypertension, type 2 diabetes, fatty liver disease. So this wasn't something that I just read about in a textbook. I lived it.
I was 127 pounds overweight. I had chronic lower back pain, knee pain. Every day was a struggle just to move through life.
We tell you this because we want you to know that we've done this ourselves. We know the formula, we know what works, we know what doesn't, not just to lose weight, but to really keep it off.
And that's exactly why we built this course. We want more providers in this world helping patients like us, patients who've been failed by quick fixes and one-size-fits-all approaches.
The obesity pandemic we're facing right now is massive, but I truly feel that collectively, if we get more trained providers in this space, we can make a real impact.
This course gives you the clinical framework, the protocols, and the confidence to do exactly that.
Okay, thank you. Let's get started. So let's start talking a little bit about neuroendocrine regulation. This is where things get really interesting, and if you stick with me, I promise it's going to make you a better clinician and a better educator for your patients. When you understand this system and you can explain why GLP-1 receptor agonists work the way that they do, you can really explain it in a way that actually makes sense to the person sitting across from you in the exam room. So let's start with two teams. You've got orexigenic signals, meaning they drive hunger and eating, and you've got anorexigenic signals, meaning they suppress appetite and promote satiety. On the hunger side, the main players are ghrelin and the MPY AGRP neurons in the hypothalamus. Ghrelin is released from the stomach. It typically is released before meals. So what this means is it goes up when you're fasting. It goes up after weight loss. It's one of the primary reasons people feel hungry, and it's one of the primary reasons weight loss is so hard to sustain. On the satiety side, you've got leptin from adipose tissue, and from the gut, you've got GLP-1, PYY, and CCK. In the hypothalamus, you've got the POMC and the CART neurons working to suppress appetite and increase energy expenditure. Now, leptin is tricky. People with obesity typically have high levels of circulating leptin because they have more adipose tissue producing it. But they've developed a leptin resistance, meaning the central nervous system isn't responding to it the way that it should. So you've got all this leptin in circulation, and the brain is essentially ignoring it at this point. High levels, blended response, it's really similar to what we see with insulin resistance in type 2 diabetics.